Hello, welcome to this session on theoretical framework. We'll look at definitions and development of theoretical and conceptual framework. My name is Lucy Kevuti Bitok. Now, literature review is the prerequisite to theoretical framework development. And the theoretical framework substantiates what you say through the literature review or what you found through direct personal quotes from different people. That is necessary depending on the research design we use. To simply put, the theoretical framework of a study is simply an explanation based on the literature you have read on how the variables in the study are expected to relate to each other. So conceptual framework is an explanation. First, it has to be fact-based. That's why we base it on literature review. And when we talk on conceptual framework, it does not contain any particular theory that explains the relationship among variables. So conceptual framework basically means you sit, analyze, and develop your own pictorial presentation of your understanding of all the variables which have been documented regarding your study area. So theoretical framework can be developed, on the other hand, if the variables have been studied before and if they've been found to relate to each other. If there is an existing theory, meaning somebody sat, synthesized literature, and developed their own conceptual framework, then once you share that and it's accepted, it becomes a theoretical framework. So when that relationship has been proposed by another author prior to a work, then it becomes a theoretical framework. It is that theoretical framework that is then tested by the researcher. We don't just pick the theoretical framework and use it raw. We require to adapt it to our situation. So we may need to add literature on the theory, update it, see how it applies to your area of research, especially geographical area, and then we can say you adapted and extended the theory of this and this author. So a theoretical framework is basically a conceptual model of how one theorizes or makes logical sense on relationship among several factors that have been identified as important to the research problem. So the theory flows logically from previous documented research, and it discusses the interrelationship among. From this conceptual framework or theoretical framework, then we can develop testable hypotheses, and hypotheses basically are developed to examine whether the theory formulated is valid or not. Even if testable hypotheses are not generated, developing a good theoretical framework is central to understanding the problem under investigation. So, if we are saying the theoretical framework involves identifying the network of relationship among variables considered to the study, then one needs to identify the problem first and then the variables that contribute to it and see how you can show the relationship between those variables. So what are the features of a theoretical framework? One, it must contain all the variables which are considered relevant to the study. It needs to show the relationship between two or more variables and how they relate to each other. At the bare minimum, there should be a relationship between the independent and dependent variable, and probably when it's necessary, we should be having confounding or intervening variables. If the nature and direction of the relationship between variables can be established from the previous studies, then that needs to be included in the discussion. The other feature of theoretical framework is that it should have a clear explanation as to why we expect the relationship to exist. And finally, we need to identify or develop a schematic diagram of the theoretical framework so that we can be able to see and clearly comprehend the theorized relationships. A picture speaks volumes. Now remember, apart from the developing the schematic diagram, we may require a paragraph or two to explain known relationships in that theoretical framework. We said that research is a lot of practice and practice and practice until we are able to inculcate all these concepts. So we want to do a short exercise and we want to work with a few examples. We want to identify the variables and develop a theoretical framework. Of course, this is a summarized form. More often than not, you do not summarize or you do not develop a theoretical framework from just reading one paper. You need to read at least a minimum of 5 or 10 papers for you to develop a theoretical framework. So let's look at one example. In this example, which is hypothetical, not really, I think there's a study which looks at that specifically. A researcher found that the level of education, sex, age, and income determines the COVID-19 vaccine uptake among informal settlement dwellers generally. However, they noted that the residents who dwelt closer to the chief's camp had a higher intake of COVID-19 vaccine. And then the settlers who were more knowledgeable about the vaccine and had reported less side effects were more likely to take a booster vaccine. We'll pause this lecture for a minute or two and we want you to synthesize by identifying 3 key issues. I want us to identify the dependent variable, which is the variable of interest or the variable of study, or outcome variable. Some call it dependent or outcome variable. We'll differentiate that as we move along. And then you identify the independent variables, and then you identify the confounding variables. You can pause this lecture for 3 minutes and develop your own before we see what we came up with. Okay, let's see an example. So, based on that scenario of assessing factors influencing acceptability of COVID-19 vaccine among residents of Kwenu County in Kenya, that's a hypothetical county, and an informal settlement in Kwenu County, these were the variables we identified. So, the dependent variable is the acceptability of COVID-19 vaccine. So remember we said you need to state it as a variable, means you can go and establish that availability is higher or acceptability is high or it could be low. And then we identified independent variables as accessibility, means am I close to a hospital, and is the vaccine available? The knowledge about the vaccine, the religious belief, the side effects, the age, the gender, the parity, and we could talk of proximity to administration. Then we have confounding or intervening variables, and this may not be directly related to that particular script we read. Remember we said we identify factors from many sources. So that diagram has an arrow which connects independent to dependent variables. It means that the independent variables influence the dependent variables. Knowledge about the vaccine will influence acceptability of COVID-19 vaccine. There are other factors which are not generally causing a direct relationship, but their very existence enhances or catalyzes the relationship between independent and dependent variable. And those are confounding or intervening variables. So probably the social media use could be a confounding variable. It may increase the relationship, or it may strengthen the relationship between independent and dependent variable. Politics of the day. If the government is laying emphasis on the COVID-19 vaccine, probably that would increase the uptake. Remember, confounding variables can either increase or reduce the interaction between independent and dependent variable. Let's look at the second example. And the second example is a lung cancer scenario. So, after literature review, a review or a researcher established that while lung cancer may be caused by smoking, being single, while the lung cancer may be caused by smoking or smoking is a contributing factor, other factors were that singles and older people were more likely to be affected by lung cancer. And then the populations who reported use of unclean fuel in cooking had higher incidences of lung cancer. So let's see a simple diagrammatic presentation of that scenario. So we mentioned that our dependent variable is lung cancer. So you go and find either somebody has lung cancer or does not have lung cancer. And then independent variables: smoking, age, marital status, and then we have use of unclean fuel, and then we have confounding variables. Probably that would probably influence the relationship between the independent and dependent variables, and probably the socioeconomic status. So imagine if you're poor, you may be more likely to use unclean fuel for cooking. If you're richer, you're likely to use clean fuel. But that does not, that may not necessarily, the socioeconomic status may not cause lung cancer, but of course, depending on the circumstances, you're more likely to develop lung cancer if you're from poor economic status. Remember, these are hypotheses which should be tested, which can be testable. Means you can go and collect data on smoking, age, marital status, the kind of fuel people use, and see whether there is any relationship between those independent variables and dependent variables. The last working example, then we can go and work on our own. It's an interesting paper which was written or reported mental health disorders among healthcare workers during the COVID-19 pandemic. It was a cross-sectional study done from 3 major hospitals in Kenya. That is the link. I would need you to go and read about it. But this study was done by Shah and others, and they found that out of a total of 433, that is contributing 5.2 response rate of what they had hoped. They had a median age of 32.75, and then 58 of the respondents were females, almost 70 or 69% were frontline workers. And they reported depression, anxiety, insomnia, distress, and burnout among 53.6%, 44.3%, 41.1%, 31%, and 45.8% respectively. So, and remember, this was from frontline health workers. Now, we had frontline health workers being male and female, and of course, they analyzed those, and they found that the Frontline healthcare workers, that means the ones who are in direct patient contact with the patient. Females and doctors were at a higher risk of mental health symptoms. Nearly half of all the participants reported inadequate resources or training to care for patients with COVID-19. Interestingly, those in government-owned facilities were more likely to report mental health symptoms. Let's pause that slide for a minute, synthesize, and we see what conceptual framework we could develop. Okay, so this is a summary of what we felt could summarize the whole of that concept. So we identify independent variables as age, sex, the profession, access to resource on COVID-19, including training, the type or ownership of health facility, marital status. And then the dependent variables were mental health disorders. And so we outlined, at times we may have just one dependent variable, at times we may have a dependent variable which is broken down. So in this case, the dependent variable was broken down into 5 components which were tested, or 5 aspects of mental health disorders. So we look at depression, anxiety, insomnia, distress, and burnout. Then one of the possible confounding variables could be the level of income. Okay, so that is a simple diagrammatic diagram or diagrammatic presentation of the theorized relationship between the variables. Okay, so we want us to go to the next level, and we want you to share. I know you've developed your conceptual framework, but I want you to share your conceptual framework for your research proposal with your colleague, and then we can discuss the same. We'll sample a few during the next lecture and see how they make sense. Remember that you need to read at least 3-4 papers for you to give us this brief summary. Remember also to do your referencing, preferably citation, even as you do that 1 or 2 paragraph which describes the relationship you have summarized in a diagram. So we'll do that, and following are some of the references we can read on how to do a conceptual or theoretical framework. In the next lecture, we'll look at hypotheses. Till then, see you. All right, these are some of our selected references. Please take time, go through them, let them assist us understand the topic more. Until next time, thank you.